Right. Okay. I think good morning. Thank you, everyone, for making time to join the surgical grand round. And this is the grand round that is organized on behalf of the AI theme, artificial intelligence theme for Nuffield Department of Surgical Sciences at University of Oxford. And the theme was started during the COVID period, and we have been trying to host a ternly um, grand round presentation to showcase the theme. And this time we have the pleasure to invite Dr. Fabien Lareyre from France, who happens to be a vascular surgeon, works quite closely with me on research projects. I'm very pleased that he's willing to present his work in this forum, both showcasing the artificial intelligence aspects and also to um, tie that into the vascular surgery theme, which is our home ground research interest. And Fabien is a consultant and head of department at the vascular endovascular surgery at the Hospital of Antibes, France. And his research focused on the application of AI in vascular surgery. And his pioneering work in this field has really been recognized by multiple academic awards from the French National Academy of Medicine and the Prize of Excellence from his regional authorities, University Côte d'Azur. And he's fellow of the European Society for Vascular Surgery, Secretary General for VascuNet, one of the largest registries for vascular surgery activities and research. And he's also a committee member of the European Research Hub and a member of both the French and European Society for Vascular and Endovascular Surgery. So thank you, Fabien. Really much appreciate, looking forward to your talk. And just before we start, housekeeping request from the team is that because it's an online forum, this is being recorded, and please could everyone turn the camera and microphone off during the presentation and only switch them back on during the Q&A part of the grand round. Thank you, Dr. Lareyre, it's all yours.
Thank you, Professor Frenchley. It's a great pleasure for me to present today. So I'm a consultant in vascular surgery, and we also have an AI team in the south of France at the 3IA Côte d'Azur, one of the three French Institute of Artificial Intelligence in France. So today I'll talk about the emerging role of AI in vascular surgery. So as you all know, artificial intelligence is a very broad domain that regroup three main fields. So you have the natural language processing, which is application for speech or written language. You have the field of robotic and innovative devices, and the field of the vision, which is application for videos or images. So machine learning is a subdiscipline of artificial intelligence where you give the machine the ability to learn from a data set, and it can be supervised, unsupervised, or it can be a reinforcement. We'll see that later. And deep learning is a subtype of machine learning where you give the machine large quantity of raw data. That's what we call big data. And some of the main algorithms used are the artificial neural network and the convolutional neural network. So AI brought new perspective in both medical research and clinical practice. So we have to keep in mind that all the AI algorithms in general are fed with a large quantity of health data, medical data, that can come from the health record, electronic or manual. In vascular surgery, you have a lot of data coming from the medical, from images and video, but you also have physiological, biological data, and now more and more administrative and environmental data. And with the increasing use of wearable devices and other technology, you have access to digital data. So when we are talking about data, we think about the 5V and all the challenges related to this big data. So the 5V, you have the volume. You need adapted infrastructure and platform to analyze it. The second V, the velocity. The third, the variety, because you have different type, format, structure of data. So that can be challenging for after. Of course, the veracity of the data. So, and to finish with the last, the value and all the potential economic value for company, but also for institution. With the other 5V, vulnerability with all problem related to data protection and security and validity. So if you add this 5V to the other 5, you move to big data to smart data. So what is an artificial neural network? One of the most algorithm used. So ANN, if you see on the picture, are inspired by biological nervous system. So each neuron is connected to multiple other neurons, and it's organized in layer. So the first layer is the input layer, and the last is the output layer. And
Fabien, sorry to interrupt. Just checking if you still have your screen sharing, because we noticed the slides disappear. If you could just reshare your screen again, thank you.
yes.
There was a short period of network interruption, I think, and your slides disappeared after that.
Okay, sure. So can you see right now the screen, the slide?
Yes, but that's on your Teams screen, not the slides. Yeah.
Good.
Give it a second. I'm seeing blank here. I just check if other people are seeing slides. It appears to be a blank screen for me.
It's blank.
And now?
Perfect. Perfect.
Okay.
Thank you.
So we've just seen in the machine learning, you have the supervised learning. The supervised learning, you have labeled input and output that are provided for training. And the supervised learning is usually used to predict or classify future events. You also have the unsupervised learning that does not require any labeled or annotated data. So this is used to uncover hidden pattern or to explore complex relationships. And then you have the reinforcement learning. Here again, it does not require labeled data, and the aim of the program is to collect as much reward as possible. And the program chooses any action as a function of the history and reward, and this is used to develop automated predictions or actions. So in the field of vascular surgery, We recently published a bibliometric analysis. So we had a look on all the original articles on the field between 1995 and 2020. Focuses on the three main diseases in our field: aortic aneurysm, carotid stenosis, and peripheral artery disease. And we've shown that we had an exponential increase of AI article in vascular surgery the last 5 years. So AI is not new, but its application in our field has emerged only recently. So there is a wide range of application of AI in vascular surgery. Can be very useful for the healthcare information system and public healthcare. Of course, we'll see that later for medical training and education. Importantly, clinical practice with new tools for biological and imaging analysis, and for medical research. And we will see how we can facilitate literature search. How is it helpful for clinical trials or for data mining to discover patterns in a large data set? So we will have a focus on the three big main field of AI in vascular surgery. We will start with the vision and imaging. Then we'll go through machine learning model and see how ML are used to develop prediction in aortic aneurysm. We'll have a focus on aortic aneurysm. And then we'll say a few words on NLP, natural language processing, and how it can be helpful to identify and extract information based on medical records. So let's start with application of AI for imaging, which is the most advanced field active. So deep learning and convolutional neural network have brought a new technique to enhance and develop automatic segmentation of the vascular system. So the segmentation corresponds to the process of partitioning a digital image into multiple segments. So we use it to process medical imaging, and we know that vascular segmentation can be challenging due to the high variability of the morphology of patients, the size, but also the curvature of the vessels. So the use of AI to improve image segmentation will be important if we want to gain time and reduce costs. So our team was among pioneers to use a deep learning model for automatic detection and characterization of the main characteristic of abdominal aortic aneurysm, AAA, and to generate automatic measurement of the vessel, including the length, the diameter, and volume. But this, it was 10 years ago, and at that time, we didn't even know that what we were doing was artificial intelligence. So since several startups have built and commercialized their software, and among them, one famous is Nurea. Nurea proposes the Praevaorta software to analyze geometrical data of the aorta, and several validation studies have been performed and demonstrated good correlation and the accuracy of the method compared to manual segmentation performed by human experts. The accuracy of the measurement was confirmed in several independent validation studies and in various type of aneurysm repair, so complex aneurysm repair, so juxta and infrarenal AAA, but also for TIVAR. So such an application can be useful, very useful for sizing and pre-operative planning. Besides, it can also be used for research purpose, enabling a fast and a robust analysis of the morphological characteristics of AAA. So this is a studies from last month. So in this study, the authors from the Imperial College they used a software, the Neurea software, and they identified sex-specific differences on a AAA morphology. So women had statistically narrower, shorter, and more ungulated aneurysms, necks, smaller visceral and access vessel diameter, and a greater thoracic aorta and a thrombus. So such results provide new insights on sex differences on clinical presentation and outcomes of patients with aortic aneurysm. So there are also other companies. I presented Neurea, but we can also present Incepto that proposes a software to enable an automatic measurement of diameters and volumes. And here also they demonstrated a good performance for segmentation and assessment of aortic diameter on both pre and post-operative CT scan after standard and complex EVAR, like a FEVAR, fenestrated EVAR. Alors, there is another interesting approach brought by AI in pre-operative numerical simulation. The company predecessors, so like Incepto and Neurea, they are French startup, proposes digital twins to simulate stent graft deployment, and the software was validated by comparing simulation to in vitro models. And then the model was also validated in clinical cases in patients who underwent EVAR. So they had 10 patients. So 7 for a standard EVAR and 3 for an unfavorable anatomy, a complex anatomy. And the position of the stent graft on post-op CT scan was compared to the predict simulation. So this kind of result showed that the numerical model predicted accurately a stent graft position in the aortic neck of 10 patients, even when it was complex. So while AI can help for preoperative planning, it can also be used to improve per-op navigation. And I'm thinking about the image fusion that has allowed to provide new techniques for intraoperative guidance. So I'm thinking about Cider Medical, and if I remember well, the company is based in Cambridge, so not too far from Oxford. And they proposes a software to improve the visualization during EVAR or complex EVAR. So now let's have a look on what we call the extended reality. Because our team is also working a lot on augmented reality, which is another field that has attracted interest for intra-operative guidance. So just some definition: virtual reality, you're in an artificial world. Augmented reality, you have a virtual object like holograms, and you're in the real world. And mixed reality, you merge virtual and augmented reality. And we published a few years ago a review on the application of head-mounted displays and smart glasses in vascular surgery, and how it can be useful for education and training, but also for surgical planning. And we will see now how it can be useful for the images-guided surgery for endovascular procedures. That's what we called the holographic endovascular concept. So I hope the video will work. So during endovascular procedures, the difficulty for surgeon is to have a constant access and visualization of patients' imaging, due to the interposition of the roll bar. So it can contribute to increase operative time, radiation exposure, and also decrease precision of the gesture. So just no, there is no video here. So a solution can be to use holographic images with augmented reality, but for that, it needs to fulfill some requirements. And we need to have an identical reproduction of images, minimal latency and real time, and of course, autonomy of freedom and movement. So here is a video of interventional holography. So you use the head-mounted display, and you commanded with a voice. I don't know if we can hear. No, it's not here. So it works with a voice command, and it also allow to perform a screenless procedure with freedom of movement. The echography is turned, and we can use the ultrasound echography with no screen because we have it in the head-mounted display as an hologram. And you can move around and you can still see the hologram because it's following you. And as I said, the latency is also important. So here is the hologram and what you can see on the C-arm screen, quite the same time. I don't know why it's not working on this, but you can adjust you can zoom, you can adjust the contrast and the brightness, and you can also perform the intervention. The surgeon can keep a direct visualization of the surgical field during surgery. So we've seen pre-op, how AI and innovative devices can be used in pre-op during procedure. And now AI is also revolutioning post-op surveillance. So for example, on this paper, the author use of software that can improve image quality. And it can allow to reduce the noise intensity and all the artifacts. It can also facilitate the detection of the AAA enlargement with a very fast and robust measurement of the AAA volume. And here we found again the team from the Imperial College, but also the team using Incepto software based in Paris. So several studies have also shown the interest of AI to detect endoleaks, because we all know that EVAR required a long-term surveillance to detect this kind of complications. So you have different type of endoleaks, type 1, due to incomplete proximal or distal sealing, type 2, if you have a sac reperfusion via the side branch, type 3, if there is a dislodgement of the graft component, or type 4 due to the porosity of the graft. And several studies have shown that AI can help to better detect this kind of endoleak. So on these studies, it was based on CT scan, but other author use it to create some AI algorithm based on digital subtraction angiography during EVAR procedure. So finally, and I will not stay longer on this because Professor Regently is very well advanced on this. Another application of AI is to improve the analysis of non-contrast CT scan. So as I said, Professor Lee is working a lot on the topic, and he is leading the Net Zero AICT Consortium. So we use AI to develop and stimulate digital contrast, and the final aim would be to replace and avoid it is used the use of traditional contrast medium in the future. So in our team in the south of France, we are working to develop, as I said, automatic segmentation of the vascular system. And we started to work on aortic aneurysm, AAA. And we are now extending the application of our software in peripheral artery disease and lower extremity arteries. Here again, to provide a fast and detailed analysis of all the artery and the branches, to measure vascular calcification, and to identify a pattern in order to develop a predictive score. So on this slide, this is our software pipeline. So it works in several steps. So first is the artery segmentation, and then we have the branch identification. After we have the detection of the lesion, including stenosis and thrombosis. And the final aim is to develop an automatic classification of peripheral artery disease lesion. For example, we use the task classification to help us to know if we have to perform open repair or endovascular repair. So we can have an automatic classification of a patient that can help the clinician to decide the operative strategy. So as a conclusion for how AI can be used for imaging analysis, it can help mainly in clinical practice for the detection, for the diagnosis of the disease, to have a better characterization of the anatomy of the patient. It can improve the reproducibility of the measurement, decrease computational time. It can help for the preoperative planning during the procedure, so in per-operative time, and also it can be useful to better detect post-operative complication, and finally to enhance analysis of non-contrast CT scan or CT scan with artifact. But of course, AI brought new new insight for clinical research too, because we can have a fast and a detailed analysis of all the characteristics of the vessels. We can identify hidden pattern and to develop a predictive model leading to what we call the personalized therapeutic approach for a patient with vascular diseases. So now, and I think regarding the time, I'll go faster on one of the major field of AI is how machine learning can be used for a prediction model. So in general, we can develop the ML model for the prediction of the progress of the disease and associated complications. So in the different field of vascular surgery, can be useful to predict for the prediction of survival and rehospitalization, and for the prediction of complication after vascular intervention. So this is like an edge decision making for what we call the precision medicine for the patients. So various literature reviews have been performed and summarized the main studies that used machine learning to predict the outcomes of patients with a vascular disease, and some of them have been performed by our team. We recently published with Professor Lee a literature review that specifically focused on a machine learning model to predict aneurysm growth and rupture. And we only found less than 30 studies that has been performed within the last 5 years. So I think I'll go faster on how machine learning model can be useful to predict aneurysm growth, of course, rupture. Yes, this one is important because among all the various published studies, I just want to highlight the work of Mohamed Al-Omran, who is working at the University of Toronto in Canada, because they have access to a large registry. So they have access to the NSQIP, the National Surgical Quality Improvement Program, so more than 60,000 of patients, but they also have access to a large North American registry, the VQI, the Vascular Quality Initiative, and it's allowed to train. Having this kind of registry, you can use a machine learning model, and you can train it on thousands of patients with vascular diseases. So they published some paper on aortic aneurysm, peripheral artery disease, or carotid stenosis. So on this example, on these studies, they trained 6 machine learning models to predict 30 days major adverse cardiovascular events after EVAR. And the XGBoost model achieve an area under the curve of 0.95, which is very good, and that perform better than the classic logistic regression. So this is for the North American. Us, with the European Society of Vascular Surgery and the group of VascuNet, we are also working to develop some machine learning model using some European registry and Australian registry. So on this paper that has been published last month by our team, we used a cohort from patients from New Zealand. So more than 2,000 patients who had a peripheral artery disease revascularization. And we trained 4 different models to predict the amputation free survival. And we had a good performance achieved with a C index above 0.71. And the feature analysis highlighted the main predictors in the model. So we developed a tool that incorporate all the key predictors for the amputation, and we developed a specific risk stratification. So we've seen how AI is used in the field of the vision with the imaging. We've seen how AI is used in the field of the machine learning model and the predictive model. Now, the third big field is the natural language processing, so which is applications for speech or written language. So you all know the large language models, so LLM. There are AI tools that have been trained to process and generate text. And now with the increasing use of Chat GPT, so this was launched by OpenAI in 2022, if I remember well. But you have also other LLM by Microsoft or Google, Medpan, that are used. So NLP in the field of vascular surgery, but also is in general hold great promises of application. So it can, for example, facilitate analysis in large data sets to evaluate current practice, to develop tools to optimize prevention and public health surveillance program, and it can generate alerts, for example, from a medical record, and that can optimize the orientation and the triage of patients, and to refer to a vascular specialist when it's needed. So among the LLM, you have the chatbots. So chatbots have the ability to handle various tasks, including question answering, information extraction, or text writing. So it can be useful for both patients, but also for health professionals. So for patients, it can be used as a source of information and be of assistance for planning and follow-up. And NLP can also be embedded in applications useful for telemedicine. For clinician, it can be used for the assistant writing, administrative work, and support for and aid decision making. So among the European Society of Vascular Surgery, we recently performed a survey to evaluate the perceptions and the feedbacks from vascular surgeons on the use of AI chatbot in vascular surgery. So we have more than 200 participants from 23 countries. So regarding the perception of the use of AI chatbot in vascular surgery, 81% believe that AI chatbot could help to save time, and 87 thought that AI chatbot should be systematically validating prior being used during our daily clinical practice. And regarding the user experience, so the use of AI by vascular surgeon, 71% had used or tested this chatbot, and 74% experienced issues or limitations. So which kind of issues? So inappropriate or inaccurate answers, lack of specificity of the answer, difficulty interpreting response, the variability, answer unavailable, lack of transparency, and sometimes the lack, sometimes you can't see from where the source are coming from. So these are several limitations of this kind of tool. As I said, the accuracy, the quality, and the readability, because the information can be repetitive, vague, or hard to interpret by patients, which can be useless or even more importantly harmful. There is a lack sometimes of transparency regarding the data source. We know that AI algorithm function like a black box concept, and also you have what you call the neural hallucination. So this chatbot can generate an output that is not related to the input. So you have some inaccurate information, even if it seems reliable. And also you have a problem regarding the reproducibility of the answer, because you can ask the same question and you can have different answers. So now let's have a look on how AI can be useful in research with a focus on vascular surgery. So AI is revolutioning vascular research, offering new tools for literature search, scientific writing, and new technique to enhance data analysis, as well as clinical trials. So during our survey, we asked vascular surgeon on how we can use AI in vascular research, and the two main use they said was one for scientific writing, and second for literature search. So for scientific writing, it can be very useful, of course, for editing, summarizing, translating. But for journal, we have to be careful. I am also an editor, and you have to know that AI is not eligible for authorship, and we have some recommendation for the use of AI during when you write a paper. It has to be limited, it has to be used not a lot, only for producing a few scientific insight, but you can use it for translating or for grammar correction. So how AI can be used in literature search? This is a pilot study that we perform within our team, and we decided to test an AI tool proposed by the startup Juicy. So the aim of the study was to test an AI-based mobile application for literature search in a topic related to vascular surgery, because we wanted to compare the ground truth provided by the traditional literature search, so by our team, performed by human expert, against the AI mobile application. And the scientific question that we used was what studies have been published on the use of AI machine learning to evaluate the prognosis of patients with aortic aneurysm. So what did the AI-based method? So the AI algorithm focused selection of relevant article, and the AI method retrieved 80% of the article identified by us, and it took the AI-based method only less than 1 minute. And for us to perform the literature search took us maybe 1 week. So this kind of tool can allow a fast and a focused identification and selection of relevant article. and it might help to complement human expertise. Note that we found 6 more articles than the AI method, but it took us 1 week instead of 1 minute. So AI can also be used for clinical trial timeline at the different phases of RCT. So, for example, during the preclinical studies, it can help, AI can help for the design of the trial to reduce sample size, trial length. It can be useful for phase 1 or 2 for the patient recruitment to, for example, improve enrollment with an automated eligibility. For the phase 2 and 3, you can have some AI-based patient monitoring to automate annotation and important markers, for example, for images. And of course, at the end of the RCT, AI tools can be very useful as a support analysis. So now let's have a focus on AI. I still have a little bit of time. AI in education. For AI in education, it has offered a new pedagogic tools. But on the opposite, we also know to improve formation and training of vascular surgeon on artificial intelligence. So as I show you before, during our survey, we noticed that 84% of vascular surgeons declared not having any training or education related to AI in healthcare. So it really underlined the need to improve education for patients, of course, but also for us. So now let's say a few words about current challenges. So we all know that the accuracy of AI model depends on the availability, the quality, and the volume of the data, the 5V, and also we have to understand that AI algorithm function like a black box model. So there is a question. There is some question about transparency and trust. And before using AI model, one of the main challenges that remain to be faced are the external validation, because if we want a generalizability in population with other demographic, ethnic, or socioeconomic characteristic, we need to perform this external validation, and we are working toward that aim with the European Society of Vascular Surgery, because we want to train different machine learning model in some country. For example, in France, it is the same in UK. So this is something we are working on. Of course, other challenges before implementation in clinical practice will be the intended use, the definition of responsibilities of AI tools, insurance coverage, the reimbursement policy. So there are many challenges that remain to be faced. And also there are issues related to access and use of health data, and mainly also ethical and legal challenges regarding the data protection, security, and all the patient privacy and confidentiality. And I know Professor Lee is working a lot on it. The data ownership and the data governance is also very important. So let's say a few words about the potential consequence of the use of AI model, specifically regarding equity, fairness, and inclusion, which is really important right now, because AI can raise concern about potential discriminations of group of patients. So the generalizability, so that's why I was saying about external validation, but also access and use of AI technology. Is it adapted for all patients? You can have sometime access depend the region. For example, some local region can't have access in other country, and I'm thinking about Australia or New Zealand. It also raised concern for health professionals because there is a risk of progressive de-skilling induced by decrease of human know and how, because we are more and more using it, so we have to be very, very careful about that. So the most importantly, we need the training and education. So regarding the impact of human relationship, the fear, yes, to be replaced by machine is not news. And I'm thinking about some movies from Charlie Chaplin at the time, about man versus machine. But what we can say is it will impact the relationship between the doctor and the patient. And there are many unsolved questions for patient and health professionals. So regarding the safety, the clinical benefits, and the potential risks, what happens if the machine learning system or AI-driven robotic procedure lead to a wrong clinical decision or adverse events? Who is responsible? Who is engaged? And which kind of procedure should apply? So I'll go faster regarding the current legal framework in Europe. Of course, you have the GDPR, the CE mark, the AI Act. I don't know if you're part of the AI Act in UK. Maybe you will tell me later. In the United States, you have the Health Data Protection, the FDA, and there is no specific law, but only principle and guideline related to AI. In China, they have the National Medical Product Administration. So regarding the future direction of AI in vascular surgery, we will have to work using international vascular registries. So we are doing this with the ESVS and the VascuNet committee. And we are working with North American people that have also their registry, the VQI. And if you merge both European and North American, you have the ICVR, the International Consortium of Vascular Registry. And I'm sure we'll have to develop some AI tool within this big group. We have to develop large-scale prospective studies and to develop international data lake. And that's what Professor Lee is currently doing greatly. Congrats. So it's really the time for what we call a multidisciplinary cross-border collaboration. So within the international consortium, you can work, as I said, with different partners, with registry group, with national registry, also with a national claim. For example, our team is trying to develop AI model using the SNDS, so the National French Claim. We have to build some and to be part of some consortium like Vascular, which is an AI consortium in vascular diseases. And we have to participate with the different European research collaborative groups. So within the European Society of Vascular Surgery, you have the European Research Hub. So now we have entered in the new era, a digital era with digital health or e-health, and it regroups many fields. Telemedicine, smart devices and connected system, health application, health information system, integrated network. So in each field, AI can be used and provide technical support to reach the intended application. So this is the last slide. I invite you to read a special issue that I guest edit in seminar in vascular surgery about what we call e-health, because I said that AIs can be used and provide a technical support in many fields, but the big field is e-health or digital health, and you will find many manuscripts related on the topic that could be very interesting to read. Thank you.